Hello, we are Group 5. Taylor Trout, Angela Tovar, Nora Toles, and Ali Thompson. And our campaign is called No to Vape, Yes to Health. We're raising awareness about EVALI, a serious lung injury linked to vaping. Many teens believe vaping is harmless, but it can lead to addiction and long-term health damage. Our goal is to educate adolescents so that they can make informed choices and choose a healthier, vape-free future.
E-cigarette or vaping product use associated lung injury, EVALI, is a serious respiratory condition linked to the use of vaping products specifically. It was first identified only 7 years ago during the nationwide outbreak in 2019. It can cause acute lung injury and require hospitalization, even resulting in death. By the end of 2019, the outbreak had revealed a rapid escalation with over 1,600 hospitalizations. All of this highlighted the previously underestimated health risks associated with these vaping products. The public health significance is grand and demonstrates risks of emerging tobacco products, especially among the youth. It requires large-scale surveillance and interventions by organizations such as the Centers for Disease Control and Prevention. Below you see 4 images. Only the lower right reveals a healthy scan. The rest, proof of EVALI, vaping product use damage. Our primary target population are adolescents aged 10 through 18, making sure to capture middle school and high school age students, since we know youth was disproportionately affected by the outbreak. We saw that EVALI patients were mainly under 35 and many in their teens. By 2014, we knew that e-cigarettes had become the most commonly used tobacco product among our youth, and adolescents often perceive vaping as safer than traditional cigarettes. We know early initiation increases their risk for long-term health consequences, proving that the need for education earlier is better. Our secondary target population is very important and includes parents, caregivers, as well as teachers and healthcare staff at school. The rationale for this is simple. Adolescents are minors and therefore rely on adults for supervision, education, and healthcare access. Parents and caregivers influence greatly in these children's lives. They can monitor their access to vaping products, risk perception, health and seeking behavior. Teachers and healthcare staff too play a key and pivotal role, identifying early symptoms, providing prevention education, and referring students for care, as well as looping parents in when needed. Our health behavior of focus has multi-level determinants. Starting with individual, we see curiosity, peer influence, and peer pressure. Most importantly, misperceptions of safety surrounding these vaping products. At the interpersonal level, we look at peer norms and social acceptance of vaping, where we can all agree that vaping has become widely acceptable in many public places. Last, the community and societal level. Access to illicit THC products is rampant among minors, and inconsistent regulation and enforcement causes additional problems. Our theoretical framework is based off the social cognitive theory. SCT posits that individual behavior is influenced by the dynamic interaction between personal factors, environmental factors, and behavior itself, which is why it's widely used in public health, specifically to understand and predict health behaviors amongst adolescents, where peer and environmental influences are strongest. Here, the key constructs are simple: observational learning, learning by seeing others' behaviors and outcomes, here especially important again when describing teens. Self-efficacy, belief in one's ability to perform a behavior. If an adolescent has already started using these products, the belief in their ability to stop is powerful. Outcome expectations, beliefs about consequences and behavior. Here, the misinformation that most adolescents have on vaping products is very important because they don't know what outcome to expect. Justification for using the social cognitive theory is simple. It's appropriate because it addresses multi-level determinants of adolescent vaping behavior. It aligns with the focus on individual, interpersonal, and communication factors. Also, research supports this SCT-based interventions as effective in reducing risky health behaviors in adolescents, making it highly relevant for preventing EVALI. Here we know that it provides a framework for designing interventions that hit where it counts, build self-efficacy to resist vaping or quit vaping, leverage observational learning through positive role models, and also modify environmental cues such as school policies and parent-caregiver guidance.
This slide outlines our intervention overview and objectives. Our program targets middle and high school students while also involving parents, school staff, and youth organizations to create a supportive environment. The intervention includes peer-led workshops, school-based sessions, a social media campaign, parent engagement efforts, and pre- and post surveys for evaluation. It will be implemented in public schools, community centers, and digital platforms over a 12-week semester. Our objective is that within the 12 weeks, students will increase their knowledge of EVALI risks by 25%, improve media literacy around vaping misinformation, strengthen refusal skills and self-efficiency, and reduce self-reported vaping experimentation. These outcomes support our long-term goal of lowering adolescent vaping rates, reducing EVALI cases, and prompting tobacco-free community norms. This slide outlines our logic model and SWOT analysis. We are addressing rising adolescent vaping, increasing EVALI cases, and the misperception that vaping is safe due to peer influence and social media marketing. Our inputs include funding, school partnerships, evidence-based materials, and trained peer leaders. These support activities such as peer workshops, school education sessions, social media messaging, parent engagement, and evaluation surveys. In the short term, we expect increased awareness and improved self-efficiency. In the medium term, we aim to reduce experimentation and strengthen refusal skills. Long term, our goal is to reduce EVALI incidents and lower teen vaping rates. Our SWOT analysis highlights strengths like school access and peer-led messaging, while also acknowledging weaknesses such as limited time and misinformation. We also consider external threats like vape industry marketing and peer pressure to ensure our intervention is realistic and sustainable.
This slide highlights the two main components of our intervention and how they connect to our theoretical frameworks. Our peer-led workshops draw from social cognitive theory. Team learn best from peers who share their experience. Many adolescents underestimate their risk of EVALI, so our awareness campaign uses real cases and cultural relevant messaging on platforms they already use. This raises perceived severity and susceptibility in a way that feels rather than lecturing. Both components are intentionally youth-centered and culturally grounded. Our evaluation uses surveys to measure changes in knowledge, attitudes, and self-efficiency, while focus groups help us to understand how teens interpret messaging. Follow-up assessments and social media analytics show whether the intervention has lasting impact and meaningful reach. Together, these strategies keep intervention-driven, measurable responses to adolescent needs. This slide outlines our 12-week timeline across 4 slots. Slot 1 covers planning, finalizing materials, training peer educators, and preparing surveys to ensure a smooth launch. Slot 2 includes baseline data collection and the start of both workshops and the awareness campaign. Early engagement metrics help us gauge initial reach. Slot 3 is the core implementation period. We continue workshops, gather feedback through focus group, and make small adjustments to keep the intervention culturally relevant. Slot 4 focuses on evaluation, post surveys, data analysis, and preparing a final report. The SWOT analysis summarizes key factors: strength like peer-led delivery, weaknesses such as reliance on self-report, opportunities from high-use social media use, and threats like pro-vaping content. Ethical consideration guide us to protecting privacy and ensuring accurate, respectful messaging.
Social cognitive theory emphasizes the interaction between personal beliefs, behaviors, and environmental influences. In adolescence, peer influence plays a major role in decision making, which is why this intervention focuses heavily on observational learning through peer modeling. When adolescents see peer refusing vaping or discussing health risks openly, it increases the likelihood that they will adopt similar behaviors. Another major component is increasing refusal self efficiency. Many adolescents understand that vaping is harmful, but they may lack the confidence to say no in social situations. Through skill building workshops and peer led discussions, this intervention strengthens their ability to resist peer pressure. This campaign also uses reinforcement strategies to reward vape free behaviors and clarify outcome expectations by highlighting the real health consequences of EVALI. Overall, this school based and community based campaign addresses both individual beliefs and social influences to reduce vaping initiation among adolescents. One major strength of social cognitive theory is its focus on peer modeling. Adolescents are highly influenced by social groups, so using peer-led discussions and visible role models is especially powerful. Additionally, it builds self-efficiency, which is critical for behavior change. Rather than simply increasing knowledge, it teaches active refusal skills, making the intervention more practical and skill based. Another strength is that it considers both personal beliefs and environmental influences. This makes it more comprehensive than models that focus only on individual behavior. However, there are also weaknesses. Social cognitive theory requires high engagement from participants, and outcomes may take time to measure, as behavior change does not happen instantly. Additionally, it does not fully address broader policy level or structural influences, such as marketing strategies or access to vaping products. Since many outcomes rely on self reported behavior, there is potential for reporting bias. In short term, we expect increased awareness of EVALI risk and improved perceived susceptibility among adolescents. When teens recognize that vaping can lead to serious lung injury, their risk perception increases. This campaign aims to improve refusal confidence and reduce initial experimentation with vaping. Over long term, the goal is to decrease adolescent vaping rates and reduce EVALI-related hospitalizations. As refusal skills strengthen and social norms shift, we may see a broader community level change in attitudes towards vaping. From a public health perspective, preventing vaping initiation among adolescents has significant long term benefits. It reduces preventable lung injuries, lowers healthcare costs, and supports national tobacco and nicotine control.